Good afternoon, Yorktown. This is Supervisor Matt Slater coming to you from Town Hall. This is our 69th coronavirus update that we've done trying to expand our abilities to communicate with the residents of the town of Yorktown to provide verified and accurate information to each of you. A quick update on the numbers, and I'm going to introduce our special guest that we have with us today who's joined us by phone. Today we have, according to the Westchester County's revamped COVID-19 dashboard, we now have 374 confirmed contagious individuals in the town of Yorktown. That again is equal to the active caseload that we are dealing with in our community. That's a net increase of 8 from yesterday's report. And according to the Department of Health dashboard, that's 38 overall new cases that have been confirmed for the town of Yorktown. Earlier this week, we've heard from our county executive, George Latimer, who's just been a great partner for the town of Yorktown. He reported that hospitalizations have increased to 393. That's for the entire county of Westchester. And so we have seen that increase from about 350 for the last few weeks. The New York State Department of Health have amended their guidance on quarantine, and it's now in conjunction with the CDC guidelines. So quarantine is now 10 days instead of the 14 that we've been following. And I'm sure we'll ask Dr. Hewitt to just comment on that briefly. I also want to just make sure that we emphasize the fact that there's no cluster zone designation for the town of Yorktown at this time. Our schools remain on winter break, and as a reminder, both Yorktown, Lakeland, as well as Ossining and Croton, because we do have small portions of the town of Yorktown that are in the Ossining and Croton school districts, they are extending their remote learning beyond the winter break to give more time for the cases to be get under control. But we do remain in a state of emergency here in the town of Yorktown. And that's an important function for us here governmentally in the town of Yorktown. It does not impact the daily operations of our businesses. It does not impact our schools. It does not impact our houses of worship. But it does allow us here governmentally to operate a bit differently. And some of the ways we've done that is by reducing our workforce, having people work more remotely. Again, as a reminder, if you need to come to town hall, we are not open to the public unless you have an appointment ahead of time. And then when you do come to town hall or any of our facilities, that you will be temperature scanned as well as answer some pre-COVID screening questions. So that's just a friendly reminder of that, because we still have people coming to town hall. There is a telephone directory on the front door. So if you did not call ahead of time, please call the office that you are seeking when you get here, and our staff will accommodate your needs. We do have some good news to report regarding the vaccine. And again, this is something that Dr. Hewlett and I are going to speak about momentarily. But I am happy to announce that the members of our Yorktown Volunteer Ambulance Corps, as well as members of the Mohegan Fire Department, have started to receive the vaccine. Members of YVAC, thanks to Captain Rick Davin, started receiving the vaccine the weekend after Christmas, and Mohegan Fire members are scheduled to begin receiving it within the next week. Lastly, and this is something else that we're going to get into with Dr. Hewlett, New Year's Eve is around the corner. Traditionally here in Yorktown, we started a great tradition of a New Year's Eve ball drop, but unfortunately this year, we could not find a way of accomplishing that in a safe manner in conjunction with our community partners. So this year, there will not be a New Year's Eve ball drop here in the town of Yorktown. Again, that's out of an abundance of caution to make sure that we are doing all we can to limit community spread. And so I want to introduce Dr. Dial Hewlett. Again, Dr. Dial Hewlett is the Westchester County Department of Health's Medical Director of Disease Control. Dr. Hewlett, thank you so much for joining us today. I appreciate your time.
Thank you very much for having me. I'm happy to be here.
So one of the things that I wanted to just jump right into with you, we've continued to see an increase in the numbers of COVID cases here in the town of Yorktown, and I'm hoping through your expertise you can shed some light for the residents of Yorktown about what you're seeing here in the town of Yorktown, but also across the county, since you are dealing with it on a countywide basis.
Oh, sure. We are seeing an increase across the county, just as we are seeing an increase across the entire state of New York and, in fact, across the nation. Fortunately, here in Westchester County, we're not in the crisis situation that they are experiencing in the West and in some of the Midwestern states where there is a lack of bed space, but we really don't want to get to that point.
Right.
One of the things which we have to emphasize is that people must continue to take this seriously. We have to have people using face masks or face coverings. We have to emphasize the importance of the distancing, trying to stay 6 feet away, and we have to also emphasize the importance of avoiding large gatherings, and that even applies to people who are in your family.
Yes.
You should confine your close gatherings to people who share your pod or your household, if you will, and not with people who are outside of your immediate household or your immediate pod, as we like to call it.
Right. That's great advice, and I know that many this Christmas followed that advice here in the town of Yorktown. But one of the things I wanted to ask, though, there is an anticipation of a holiday spike, and one of the questions that I'm getting from our residents is if the increase in numbers that we're seeing in the last few days, is that a reflection of the holiday spike, or are we still anticipating more of an increase to come?
We are anticipating more of an increase to come. As many people have probably seen from the newscast, there were record numbers of individuals who were traveling this year, and we know that many of the residents here in Westchester County have chosen to travel outside of the state, and probably some have chosen to travel even outside of the country. And by traveling, one is increasing their risk significantly of acquiring the infection. We know that in different parts of the world, specifically in the United Kingdom, but now in other parts of the United States, there's a new strain of the virus that's been isolated, and that new strain carries with it an increase of about 60% in terms of the transmissibility of that strain. And so that is one of the reasons why travel really should be discouraged at this point until we have this pandemic under control.
Do you know, Dr. Hewlett, could you tell us, to your knowledge, has that strain been identified in the state of New York at this point in time?
Well, it has not been identified here in the state of New York definitively. However, we have to put a disclaimer on that. And unfortunately, we in the United States do not have the same capabilities that some of the other countries and regions have of identifying the various strains. That is, our surveillance programs are not really what they used to be, and as a result, we don't really have the capabilities. And so we may have missed it. It may be present and we don't know it. That's what a lot of experts feel.
Yeah. I know that they did identify one individual in the state of Colorado with it. So I think that's, and I know that the state of New York and the Department of Health, and we've heard from the governor that they are trying to identify whether or not that strain is in fact here in the state. But I think that's a great disclaimer for people to understand and recognize at this point in time.
Yeah. Yes, for sure.
As we look forward,
but the good news.
I'm sorry, Doc.
I'm sorry. But the good news is that the vaccine is believed to still be active against this new strain, and the precautionary measures, which are effective against the old strain, are also effective against this new strain.
And then, speaking of the vaccine, you heard me say earlier that we've got some members of our EMS personnel that have started to receive it, which is great news. We are a community full of frontline responders, frontline workers, especially our nurses, our doctors, and our police and EMS. Could you provide some insight as to the distribution of the vaccine for people at home as they are trying to understand and educate themselves more about the process and how they can obtain the vaccine when their time within the vaccine distribution period comes up?
Well, yes, I can tell you what I know so far because this is truly a moving target.
Yes.
Westchester County has been allocated vaccine, of course.
Yep.
And the hub for vaccine distribution is the Westchester Medical Center. It is being determined exactly how much is going to be going to the various areas. That is being determined by the state of New York. But the distribution hub is going to be Westchester Medical Center. Now, we have had meetings with our commissioner, Dr. Amler, and the team, and we were actually meeting as recently as this morning, talking about our plan for the Westchester County Department of Health. We are going to be receiving an allocation, and right now, the plan that's in place is that we will actually start to administer the vaccine as early as next week.
Right.
And it's our plan to continue to administer the vaccine until adequate numbers of people have been vaccinated countywide. Our capacity is relatively small compared to some of the larger centers, but we do anticipate being able to vaccinate at least maybe 300 or so people every single week. The plans are still in place in terms of the prioritization and the listing and how one will actually be able to make appointments for the vaccine.
Do you know, Doc, if Dr. Hewlett, would you know what the mechanism in place is for residents? Are they being notified when it's their turn on the according to the vaccine distribution plan, or how is that communication being provided to consumers and residents?
That is still the plans for that are still being worked out.
Okay.
We know that individuals who fall into those first categories, they called it the category 1A and category 1B and 1C, which consisted of our healthcare providers, doctors, nurses, first line responders such as our emergency medical technicians and people who were in that capacity were in these early categories. And then we know that our individuals are older citizens who are residents of nursing homes, long-term care facilities, assisted living. They are certainly in this category. And then we are going to individuals who are considered our essential workers or first-line workers. And then, of course, you're going to have individuals who have underlying conditions which place them at higher risk. So I don't know exactly from an operational standpoint how all of it is going to be worked out in terms of how people are going to be notified. I know that there is going to have to be a mechanism by which people would be identified when people receive this vaccination, because they're going to be receiving it under what we call emergency use authorization. It will be necessary for people to fill out a registration, and they will be provided with access to what we call a fact sheet, which will contain information about the vaccine, what to expect after getting the vaccine. And everyone should know that the vaccines that are available right now from either the Pfizer company or from the Moderna company, they require 2 doses. And with one of the products, I believe with the Pfizer product, the doses are 21 days apart. And with the Moderna product, it's 28 days apart. And the very good news is that the vaccines are very, very well tolerated. I had my first dose already myself from the hospital where I work, and the effectiveness is estimated to be between 94 and 95%. So that's all good news. The other good news about the vaccines is that there are going to be additional vaccines that are going to be available to us as we go into 2021. There's a vaccine from the AstraZeneca company that has been very well tolerated and that is very effective. And then there are other companies, I believe the Johnson & Johnson,
Yeah.
Janssen, they have a vaccine that's going to be coming out as well. And it's important for all of these vaccines to be out there because different people will have different needs. And I think that it will be in everyone's best interest to have several different choices available.
Can you quantify for us that's all fantastic information, and again, a good reminder that Pfizer and Moderna are not the only two vaccinations that would be available to us in due time. But can you quantify for us, for people who hear, you said between 94 and 96% effective, with regards to other vaccines that have been produced and that are distributed, can you give us an example of
Sure.
what does that mean in regards to the vaccines that people already take, like the flu shot or the MMR vaccine that we get?
Sure.
Yeah.
The flu shot, we're actually happy with the flu shot if we're up in the 60% range for effectiveness.
Wow.
One of the other vaccines that people commonly talk about is the measles vaccine,
right,
which is in that same range of 90%. So all of the leading scientists are very, very happy with this 95% number. In fact,
That's
it's
great.
higher than anyone expected.
I think it's really important for people to understand, because that's a question that I continue to see and hear and receive from residents, is understanding, the effectiveness of the vaccine and compared to other vaccines that people get on a normal basis. And
Yes.
the flu shot in
Yes.
particular is a great quantifier for us when we're talking about the vaccine, understanding just how effective and important it is for residents as we continue to emerge from this terrible ordeal. Dr.
Yes.
Sheehan, the last thing I just wanted to bring up, tomorrow is a New Year's Eve, and I know people want to celebrate the end of this horrible, horrible year because it's provided just an unprecedented amount of challenges for our country and for our residents here in the town of Yorktown. Could you provide us with some type of level of advice as to how you think the best way for us to safely celebrate the 2021 year and the end of this 2020 year would be?
Sure. My advice would be to stay within your household or to stay within your pod. My wife and I, we celebrate Christmas, and so over the Christmas, it was just the two of us, and we went on Zoom calls with our 4 children who are in different cities. And I would encourage people to do that. We understand that everyone would like to be together and everyone would like to be in the same room, in the same house. But in order for us to maximize our chances to be around this time next year, it's important for us to exercise some restraint and caution, because this is not over. The new strain is much more transmissible. We have to keep in mind that the mortality rate from this infection is 2%. And that's very high when you think about it. And it's even higher for people who are in the older age groups and for people who may have underlying conditions like heart disease and diabetes and respiratory disease. So it's very, very important for people to not underestimate this. And we know also that we're worried about our children, and unfortunately, children can also have severe disease. And so it's not just that the children will get mild infections and there's no worry. In Westchester County, there have been over 40 children who required admission to the intensive care unit, and we actually lost one child last spring as a result of COVID. And so we don't want any more losses. And so everyone should try to keep that in mind and try to sacrifice a little bit for this holiday so that as we're ready for the holidays next year, we'll all be healthy and ready to enjoy those holidays.
Absolutely. And sadly, I can say that here in Yorktown, I've been made aware of at least 4 residents, unfortunately, who've lost their battle with COVID just in the last week. And so that that is a serious threat, obviously, to the population and to the residents of our town and to our loved ones and to our neighbors. And that's why we're just trying so hard to provide as much information as we can to the residents of this town. Again, this is the 69th video update that we've provided, oftentimes with experts like Dr. Hewlett, and we've done those Q&As to try to provide answers to questions from residents. But we do this to make sure that you make responsible and smart decisions. And I understand that the fatigue is real, COVID fatigue is real, but there's, as you can hear, there's light at the end of the tunnel. And we're nearly there with the help of the vaccine and the incredible work done by medical professionals across the country developing these vaccines. But we just have to hang on just a little bit longer. And I know, again, that people are frustrated. I know that people are tired of hearing, wear a mask, as you know, and I wear a mask to show it's important to wear a mask, wash your hands, the social distancing. And if you're not feeling well, stay home and contact your healthcare provider. I mean, these are the basic steps that we've been talking about since March. I know people are tired of hearing of it. I'm tired of talking about it, but this is what's going to keep us safe and keep us and get us to a place where we're going to be able to enjoy our community again, reopen our state again, and enjoy a life that we've all come to cherish with our loved ones. The severity of the virus is still here. The numbers, as we've said, have continued to increase, and it really comes down to the efforts by our community. And I think the town has done, and our residents have done a great job adhering to the protocols and the precautions and to the information that we've consistently provided. But now's not the time to let up. COVID's not taking the holidays off, and neither can we. So please make the right decisions for the rest of the holiday break, for tomorrow night, and let's try to put ourselves in the best position we can as a community, because it's going to take a community effort to put our community in a position to reemerge from this virus as quickly and effectively as we can. We've got great help thanks to our friends at Westchester County. Again, to our county executive, George Latimer, to Dr. Amler, to Dr. Hewlett, and the entire Department of Health team. Really been great and responsive. Whenever we have questions, I have questions that I get from residents that I don't know. I go directly to them as the experts. And again, I want to thank Dr. Hewlett for taking time out of his busy schedule to join us to provide directly to the residents of the town. So Dr. Hewlett, again, thank you so much for your time and all you've done.
Thank you for having me.
Pressing ordeal for the residents of Yorktown and Westchester County.
Thank you for having me, and Happy New Year to everyone, and stay safe.
Have a Happy New Year, Dr. Hewlett, and to the residents of Yorktown. Have a happy, healthy New Year. Let's start it off on the right foot by making those smart, responsible decisions that will help our community overcome the COVID-19 virus. We'll have more information, any more information that we do get, again, that's verified and accurate. You know that we're going to provide it to help you make better decisions and more educated decisions. So until then, stay safe, stay healthy. Happy New Year. We'll talk to you soon. Thanks so much.